I'm Angie Carpenter, Town of Islip Supervisor and the hostess of Supervisor Spotlight. And I'm really delighted today to be bringing a guest to you that's going to tell us a little bit more about herself and the wonderful institution that she heads every day. And that's Irene Macyk, who is the CEO or the Executive Director. I'm not quite sure ever what the title should be, but she's like the CEO of South Shore University Hospital, which is part of the Northwell system, formerly Southside Hospital, right in the heart of downtown Bayshore, and so much a part of the community for so many years. So tell us, first of all, how you got into healthcare and how you landed in Bayshore.
You know, I'm still not quite sure how I got into healthcare. You know, when I left high school, I went to school and started studying mathematically applied physics. I wanted to be an astronaut.
Oh, dear.
I'm kind of lost in space, but that's okay. I happened to have an experience in the summer between my junior and senior year where I went to go help my cousin take care of my grandmother in Brooklyn. After day 3, she said, "Oh, you must be so bored, come to work with me." And so I did. She was a child life specialist at Downstate Hospital in Brooklyn. And she said, "You know what, I work in a playroom. Go into the tent and play with this young child." And so I went into this tent, and with dolls, I was playing with this young child who hadn't been verbal the entire time she was there. And in a very short period of time, she gained trust with me and started to do things with the doll that showed that she was having some horrific abuses.
Oh, wow.
The team swarmed around us. At the end of the day, they debriefed with me, and they said she had a breakthrough. Through play therapy,
how exciting.
She was very comfortable with you. She was able to express some of the things that have been going on with her, and now we know how we can help her. Well, I was hooked.
That's
I
great.
had to do this. I had to go into healthcare. I had to become a nurse. I had to become a pediatric nurse. I had to become a clinical nurse specialist, and I had to use play therapy to help kids cope.
Now, so that if that isn't an affirmation of how important internships are, how important it is before you make a decision to kind of get your feet wet in the field, that's awesome. That's really, really awesome. I've had a couple of experiences like that with interns or people that have shadowed me during my tenure in government. And one young woman in particular who was absolutely incredible, she had decided that at the end of 2 weeks, she said, "Oh, I'm not doing what I thought I was going to do. This is what I want to do," So it's really, it's great. It's great to hear. Really great. So you were a nurse for how many years? How many years were you in nursing?
So I've been a nurse for over 40 years.
Wow.
And I did go on to be a pediatric nurse. I spent many of my clinical years at Stony Brook University Hospital. I was their pediatric clinical nurse specialist.
Mm-hmm.
I actually taught in the academic program, teaching the undergraduate pediatric program at Stony Brook. Was not doing child life and play therapy, but really helping interprofessional teams work together, driving plans of care, doing a little evidence-based practice, a little bit of research, and I think really making a difference in how we cared for children at the state system.
That's really incredible. It really, really is. And so now, you spent all of this time in nursing, and I think that having been so entrenched in the field at the bedside, really doing it, has got to make you as the CEO of a healthcare institution that much more effective. From someone just coming in who has a degree in administration and, could maybe run it, but there's got to be a whole different degree of compassion and care that comes out from someone like you who's had the training that you've had and the experience that you've had.
Well, I think, when you think about street credibility, I think the clinical team members know you're one of them and you fully understand the challenges of the day-to-day. Nursing school teaches you what they call the nursing process, which is really a problem-solving model that you can apply to any problem put in front of you. So it's not a far stretch to understand nurses and their training running hospitals. There's a few and a mighty bunch of nurses that you'll find as presidents and CEOs of hospitals for that very good reason.
It seems that South Shore University Hospital has a history of that, because if memory serves me right, your two predecessors were in the medical field before they assumed the role running the hospital.
That's right. So I am succeeded most recently by Donna Morovic,
Right.
a registered nurse. Cardiology was her specialty. And before that, Winnie Mack,
Right.
another registered nurse. So as you can see, South Shore hires nurses to be president, and you have to begin with the letter M and end with the letter K.
Pretty interesting, pretty interesting. So put that on your resume when you went. That's great, that's really great. You know, tell me about the day-to-day of being the CEO of a healthcare institution. What's your day like? What's an average day, which I'm sure there's no average day, because I can relate to that.
Well, there's predictably, you know, I will wake up and I will brush my teeth. And that's where the day deviates.
Ah, gotcha.
You know, every day is a little bit different. I mean, there are certainly planned meetings that you go through, but a lot of it has to do with engaging with your team members, meeting with your community members, understanding the programs we have, how good they are and how we get better, looking at our quality metrics, working with the finances to make sure, you know, we are a business, that the business is moving forward. So each and every day has a different look. But everything is driven towards making us the best organization we can be.
Well, you really do an awful lot to making that a reality, and we're just so delighted. And I have to say this as the supervisor of the third largest town in the state of New York, to not only have South Shore University Hospital, but also Good Samaritan University Hospital. And I know you're competitors, but you're not competitors there. I mean, so much need out there. And I know that the institutions work collaboratively, but for me, especially as a supervisor, to know that I have two top quality healthcare institutions in the town is really remarkable, and you know, something I'm quite proud of, quite frankly.
Yeah, we're incredibly lucky in the town of Islip that it really doesn't matter where you go, you know you're going to get the best of care. And I think that's important. You know, as you said, we do a lot of things collaboratively. Most recently, we just participated in a multi-agency emergency response drill with a train versus truck where they triaged the patients, and between the two of us, we separated where the victims would go and ran through this in real time and with real actors. And you know, it's just another thing that we do in collaboration to make sure that we can take care of our patients the best we can.
You know, we are not immune to emergencies, you know, in the town, you know, certainly across the country with everything that's been going on lately. And emergency management is very much a part of what you need to do and be aware of and train for and be prepared for each and every day. So what you've just shared certainly codifies what I instinctively knew, you know, about what the hospital does. But tell us some of the other things that you might do in the line of emergency preparedness.
Listen, unfortunately, we're in a world where we have to always be ready. And so we have a playbook on pretty much any scenario that you can imagine, weather being logical. Here we are on the South Shore, close to the water, hurricanes or something that we have to prepare for. Hurricane Irene is probably
Hurricane Irene.
It wasn't me. I had nothing to do with it.
On that
and
note,
Katrina.
On that note, we're going to take a break, and we will be back with Hurricane Irene Macyk from South Shore University Hospital.
You're watching ITV, Channel 18, Islip Television.
Hi there, it's Angie Carpenter, Town of Islip Supervisor. Welcome back to this edition of Supervisor Spotlight. And we're really excited today to have with us Irene Macyk, who is the CEO of South Shore University Hospital. You know, we were just talking a little bit about, before we took the break, about emergency management preparedness. I mean, obviously we do that at the town on a regular basis. And, you know, you can never, you know, predict what's going to happen. And if nothing else, I think we learned that from COVID, from the pandemic. And during that whole, you know, time, it was like they never gave us a playbook for a pandemic, and I know that was very much something that you guys tackled head on and in a very professional way, in an effective way.
Yeah, listen, I credit our partnership with Northwell Health. They were incredibly proactive and a little bit ahead of the word as far as making sure we had the right supplies, making sure we had the protective gear for our employees, and we were the organization that always said yes. It's not a secret that we were the first vaccination being given in the United States. When you look back at the research, so much information about how to manage COVID patients, how to manage through a pandemic, how to invest in your employee base, because there was a lot of burnout, a lot of worry, and a lot of fear. You'll see that published through Northwell, because we had the research leg that kind of pulled together all the experts, the lessons learned from what we had done, and published it so that we can learn for the next time, because there probably will be a next time.
And not just for South Shore University Hospital and the institutions under the umbrella of Northwell Health, but for those of us running towns or other businesses, et cetera, to be able to glean from what was learned during that stressful time. When I think back to how we lived our lives for that period of time, getting a delivery to the house and spraying everything, before you opened the box. I mean, if somebody, would tell you you would be doing that, you'd say, come on, But we did. People were frightened, and, suggestions or protocol was being handed out there, and we were following it, wearing masks, and I think my skin is still raw from all the hand washing that I did then and continue to do now.
Which is good, because I think we learned during COVID that when you're sick, stay home, wear your mask, wash your hands. It's the best prevention to help us weather any of the flu seasons, the COVID seasons, the RSV seasons. So if we don't forget those lessons, we will be better because of it.
That really was a lesson learned. It's ironic. The other evening, I went to a wake, and I'm standing online, and as I'm standing there, I had signed the book, and then I went a few more steps, and there was a bottle of sanitizer. So I used it, and the gentleman standing behind me said, well, that was a very good thing to do. And I just kind of looked at him, and he's a physician. And we started chatting and saying how important it is, and that was a lesson learned during COVID. I would have never thought of, using sanitizer when I see it like that, but it really does make a difference.
It really makes a difference.
Yeah. So tell me a little bit about, I know that out in the business world in general, people are stressing now over hiring. Getting employees, keeping employees. What is it like in the healthcare world? Because I'm hearing it's tough. It's tough sometimes. And you've got all kinds of disciplines, from custodial, all the way up to surgeons.
I think recruitment is something that good leaders always keep an eye on. We've learned that employee health, employee well-being is incredibly important. So you'll find at South Shore University Hospital, we do a lot of things to help our employee base let us know when they're under stress. We have what they call a code lavender, where if there's something particular going on in an area, we can bring experts to them so they can talk it out, breathe a little lavender, take a breath, and kind of defervesce a little bit. But on the broader front of recruitment, we have to always be thinking of the next generation. And we're fortunate in Northwell in that we have a School of Nursing and a medical school, so we're able to bring some of the more common professions into the world. But we also afford an incredible relationship with all the other schools of professions. I'm thinking radiology specifically, where it's very hard to get good, skilled, trained radiologists into your radiology techs into your building. And so we afford, because we're a tertiary care facility, a lot of clinical experiences the schools can do, bring their students in, work with the experts, and learn. Additionally, we do a lot of recruitment fairs, and we'll bring the local communities in for a lot of the entry-level healthcare kind of jobs, your EVS and your food and nutrition, so that people can come in, get exposed to healthcare, and then with their tuition reimbursements, be able to go back to school and pick a specialty that they want to do and start to really have a grow organization.
And have a career.
And have a career.
And have a career that is so meaningful. I mean, I've had family members go through healthcare issues and have been in healthcare institutions and emergency situations, non-emergency situations. But when you look at the dedication of people in the field, whether they're the custodial staff, you know, who are like working so hard to, you know, the doctors and those at the bedside, it's really, it really makes you take note and be appreciative of those that have that calling.
Yeah, I'm actually glad you mentioned that. You know, the one thing that attracts me to South Shore University Hospital, which I think makes it a unicorn amongst healthcare, is that the sense of pride in every employee in that hospital. It doesn't matter where you are and who you're talking to, they'll look at you, eye contact, smile, how are you? They'll walk you to your next destination. And I think a lot of that is because we employ so many people from our local community, and they have a sense of ownership of the hospital. It's their place.
Yeah, that's great. Well, you know, I like to think, and I do believe that in the town of Islip, across the board, our employees are kind of like that.
Yeah.
They care about the town, they care about servicing, you know, the residents, and it really, really shows. I get letters that I obviously share with personnel and their supervisors when they come in about how caring someone is, and that's, you know, really as it should be. That's really as it should be. Isn't always, but
Yeah.
yeah. So anyway, we are going to take a little break, and we will be back with Irene Macyk, the CEO of South Shore University Hospital.
You are watching ITV, Channel 18, Islip Television.
Hi, this is Angie Carpenter, Town of Islip Supervisor, and we're back here with Irene Macyk, who is the CEO of South Shore University Hospital, on our latest edition of Supervisor Spotlight. So, Irene, we were talking about employees and how wonderful yours are and how wonderful I believe and know mine are. But they're, you know, to the, you know, subject of employees and providing an environment that is all it can be, you are in the midst of major, major construction. Tell us about what's going on there and how it really is going to impact not just those that are going as patients, those that are coming to visit, but certainly those that spend every single day there working.
Yeah, a year ago we broke ground on a new 90-bed pavilion.
I was there.
If you drive past on Montauk Highway, you can't miss us. We stand 6 stories up in the sky. The last piece of steel went up in September of last year. It will be 90 single-bedded rooms, med-surg, tele, and critical care.
So how many beds will that give you then?
That'll put us over 400.
400 beds.
Yeah.
And 90 will be single-bedded. You have single-bedded rooms now?
We do have some now, yeah. And I think one thing we learned in the pandemic, infection control and isolation becomes paramount. And so the more we can get to a single-bedded design, the more we'll be able to take care of the next crisis coming through the door, if you will.
And if I'm not mistaken, from what I've read, that seems to be the goal or the model now in healthcare, is to have people in single-bedded rooms, private rooms.
and to build family welcoming spaces. So it's not just the patient in the bed or the care team that cares for them, but to be able to invite a significant other to be at their loved one's side. Imagine, you know, your mom or your dad has dementia and they're in the bed, the ability to pull open a cot and sleep in the room with them and have all the amenities you need and comfort and still be able to be close to your loved one so that they don't sundown would be amazing.
That's really so very, very important.
Yeah.
And creating that environment, you need space.
Yes.
So therefore, how many square feet is that?
Oh,
do you
don't
know?
ask me that question.
Oh, okay. I didn't ask that question. Forget I asked that question. More than 100.
I want to say 100, but I don't want to misspeak.
No. It's a lot. It's a lot. You know, 6 stories, 90 beds. That's an awful lot. And you know, it's not like putting an addition on your house, adding a room when you're adding a patient room, or you know, an OR suite or whatever. To think about what takes place in outfitting it so that it is functioning.
Yes, yes. We're trying to create centers of excellence on the floor. So imagine that you're a cardiac patient, that you see your cardiologist regularly, and if you happen to be in the hospital for cardiology, we'll have rooms for you there. But if you have to have open heart surgery, we'll have critical care cardiology on the same floor so that you can go to those rooms, be cared for the intensivists, and as you get better, step down to the more general patient care rooms, but still be in close proximity to the entire care team that have the expertise should any mishap occur.
Yeah, that really makes sense. You know, how is this affecting your emergency department? Is that being expanded in the process of this, or what's the status of that?
So the emergency room was replaced a couple of years ago. Actually, it
was I remember.
enlarged. What this will do is allow us to now get patients up to inpatient beds, because one of the things, if you've been to South Shore recently, particularly in the winter time, is, you know, we're victims of our own success in that we've got a lot of patients that are oftentimes housed in the emergency room already admitted, waiting for a bed. So the ability to put people into the extra 90 beds will actually decant that and allow the ED space to be used for what it was intended to be, which is ED space.
Yeah. Emergency rooms are like, I've been there with friends and family, and it's really remarkable when you just sit back and watch everything happening. But such a service,
it's such a fine orchestration of talent. You know, when you think about, everyone comes in with a big unknown. So there's the triage piece and making sure that people get to the care they need in the time frame they need based on that assessment is critical. And I will say that the emergency department at South Shore University is probably one of the best at doing that I've seen, best in breed. You know, world-class doctors, nurse practitioners, physician's assistants, registered nurses, PCAs, technologists, et cetera, working in fine orchestration to take care of your immediate needs and then get you where you need to go.
Yeah, and you said immediate, that's the word. You know, you just don't know what the situation is, and you can't run the risk of taking too long, because sometimes those seconds make a difference.
Absolutely.
And they certainly do it, and do it right.
Yeah.
But so, listening to you say that sort of reminded me of something else I wanted to touch on. How, because it's so integral in what we do in the town in trying to deliver services, and that's the use of technology. That certainly has changed over the years for healthcare too. So tell me about how that affects you at South Shore.
The kind of cool stuff, when you look at the growth of our robotics program and our augmented reality programs, all the things we're doing for minimally invasive surgery so that you don't have as much trauma to the surrounding tissues and you recover quickly, are out there, and you're starting to see it publicized from South Shore University Hospital. As we walk into the new building, we're looking at even more technologies. One, our digital front door, making sure patients can interact with us very quickly and seamlessly. When you look at the rooms that we're building, they will be, you know, technologically savvy, if you will, having interactive TVs, the ability to video conference in your family when the care team is in there, as well as order your...
That's great when you think about it, because how often, even just going for a doctor visit, you know, you walk out and like, what did they say?
Absolutely.
And to be able to have the family listening at that time is going to
Yeah.
be that's great.
Yeah, and then we're looking at software for wayfinding so that you don't get lost in the building. As you know, it's an enormous stressor for a lot of people. And then the ability to order your meals, room service, from your tablet inside your room, because we employ Michelin chefs. And
Well,
we're
that
world-class
I do
food.
know. I mean, I'll tell you a story. Someone I know was visiting someone at the hospital, and in the next bed, it wasn't a single-bedded room, but in the next bed was someone who was being visited by their family member who was a professional, and they ordered dinner for their dad and ordered a second helping because the salmon was so delicious and he wanted to take it home. I'm like, okay.
Yeah, that's not uncommon. We have a problem getting patients home because they want to stay for one more meal.
But that's, she's not making it up. I do know someone who was in the hospital for a hip replacement, I believe it was, and is a single person, doesn't have someone cooking meals for them, and said, I really hated to go home because the food was so good, and I don't have somebody to cook for me every day. So, but those are the kind of things that, I don't want to say are simple enough, but easier to address than some of the challenges you may have providing health care. But to be able to provide meals that people are like, oh God, hospital food, they're not saying that anymore.
Yeah, I mean, listen, we're a strong advocate for food is health. And having your Michelin chef making the food with the fresh grown produce, to the patient's liking and ordering, is a natural thing to do to promote health.
Exactly. And, if you can't do it as a hospital or a healthcare institution, then there's really a problem. I had a few things I wanted to ask you about, but one of them that we didn't touch on, but I would like to, because I know you're going to shine, and that's community engagement.
Yeah.
South Shore has always, been there. I remember way back when I was in the legislature, and we talked about the crisis at the time, which really hasn't changed much, but getting nurses, hiring nurses, and I engaged the community college and put together a little bit of a task force, if you will. This is going back like 25, 30 years ago. And, Southside did not hesitate to participate, and sit there with the health department and other, key stakeholders in trying to see how we could address it. And turned out, and I know Suffolk Community College has a very robust nursing program, but they said, they couldn't get clinical time.
Yeah.
And like the hospital, well, that's, we'll do that, we'll do that.
Yeah.
So if you can quickly give me another example of community involvement.
Yeah, I mean, the community that surrounds Bay Shore is incredibly important to us. For me, it's personal. I'm from the town of Islip, born and raised there.
We're
born
very
at
happy
South
you
Shore.
are.
Yeah.
Me too.
Right? And so I think, the more that we can engage in our community to understand the unique needs of the community and be able to be proactive around that, you'll see us working with the Family Service League. You'll see us working with the NAACP of Islip. You'll see us with Mercy Haven, trying to understand really what are the learning needs of the community so we can take a more upstream approach.
And working with the town of Islip.
And the town of Islip, we sit on
on flu shots for our employees. But I think that if you didn't have that sense now, after meeting with Irene today, I think everyone out there listening and watching can know and feel comfortable that they truly, truly care about the community each and every day. So we thank you for being here, watching Supervisor Spotlight, and thank you, Irene, for being a part of it today.
And thank you, Angie.
Thank you.
You're an incredible superintendent, and we appreciate you.
Thank you.